Baler Aurora is most famous for its beaches and the beautiful waves that crash against its shore. Initially known by few, the city has slowly gained popularity in recent years. It is a home of 36,010 Filipinos, and they are part of the 201,233 living in Aurora. According to the head of the Provincial Health Office, Dr. Luisito Te, although there are 2 hospitals in Baler, the rest of Aurora relies solely on the services provided by health center. Otherwise, they would have to travel for a long distance to visit a hospital. Serving the whole of Aurora are 19 government doctors, but all of them are general practitioners. Thus, there is a lack of specialists, including neurologists. Considering the lack of neurologists, a problem that persists in the area is the lack of neurological information. To better illustrate this problem, imagine a person, Mang Juan, who suddenly has trouble speaking, trouble seeing, and feels numbness or weakness in his left arm. His family, however, thinks that Mang Juan is only tired from a day of fishing, thereby advising him to take a nap. Little did they know that Mang Juan was experiencing the symptoms of stroke. If ignored, the situation could lead to disability and, even worse, death. If only Mang Juan's family knew what was happening. If only they recognized the symptoms. If only they knew how to respond. If only they knew where to go. If only they knew. With Brain Alert and its partnership with the Philippine Neurological Association, these situations can be avoided or prevented. How? Our partner organization, the PNA, has an Adopt a Province program, which aims to provide neurological services in areas where there is none, and to empower and train the healthcare professionals in first aid, including identifying neurological signs and cues. In this medical outreach, volunteer neurologists visit Aurora Memorial Hospital every 2 months, giving them a chance to avail of neurological services. However, our team found out that patients don't necessarily retain the neurological information given to them. For example, doctors in the medical outreach express the returning patients forget their diagnosis and medications. Thus, our team wanted to help the residents of Aurora. Our design challenge: what then can we offer to communities or residents of Aurora who have limited access to neurological information? The team came up with a neurokit, a plastic envelope containing the following: a brochure which contains information on the symptoms, early treatment, and management of neurological diseases. This also includes data of the nearest hospitals with CT scans or EEGs, as well as complete contact information and clinic hours of neurologists. A medical booklet which includes a table with a list of prescribed medicines, why, how much, and when it should be taken. And a medical ID which consists of the patient's important personal information, such as their contact details, their SSS, GSIS, and PhilHealth numbers, and emergency contact numbers. Last February 28, Brain Alert together with the PNA went to Aurora to distribute the kits. Now, 55 of the 201,233 people in Aurora have access to reliable neurological information, a small yet significant step in achieving our vision of increasing neurological information accessibility. Like our Facebook page and know more about Brain Alert, a team that hopes to help the people of Aurora one neurokit at a time. Once again, we are Brain Alert. Know your brain's worth. Be alert.